When I started with the state, I was going to be come to the state, work for a couple of years, get some experience, and go with a private company that had more, paid better. And then in that time, I got married, and the benefits of the state, I stayed with them, and then eventually the pay got better too.
Before I went to the state, as I mentioned, I'm a retired registered nurse. After graduation, I started working in area hospitals right here in Hartford, Connecticut. And I worked sometimes part-time, sometimes full-time, depending on what the situation of the moment was. But one thing I definitely remember was that as a healthcare worker, I did not have healthcare benefits myself.
Well, my oldest was born in 1961. The health care did not cover him in the hospital. It did not cover the nursery. It did not cover the pediatrician. There was no dental. And so I had to go and take out an independent health care plan to cover the future children who were born. I had 5. So the health care was nothing. Pratt & Whitney was one of the biggest employers in the area. And they had good health care benefits, they had good, and they generated the cost of health care in this area. And the state wasn't paying, and then we had no health, very little health care.
Wow. Now in those days, yes, I was younger and I probably didn't have to worry too much about health care, but it was always sort of a nagging kind of a thought. And it was, this was in the 50s and 60s that I speak of. It was before nurses actually started to get together and be able to bargain somewhat for their benefits. Actually, when I took the job with the state, a part of my reasoning was that there were some benefits. Now the healthcare benefits, I would say all benefits at the state, were not as good when I started in 1972 as they have become since then. 1972 was just before collective bargaining came in. Collective bargaining came in about 1975 for state employees. And once collective bargaining was there, state employees seemed to be able to better their positions as far as benefits were concerned as the years went by.
Collective bargaining was the key to all our advances from 1977 on, because again, the politicians got tired of us badgering them. That's what happened. So they said, we'll give you collective bargaining and you get off our backs. I said, fine. And that's just what we did. And we sat down through the mechanisms and we negotiated good contracts with the state.
Now, when the present healthcare package came through for state workers in 1997, they were some of the good healthcare benefits. But remember, this is 1997. And at that time, and I'm going to quote actually our director here, at that time, state workers had the Chevy plan of healthcare benefits. They were good, but they were about what everybody else in the private sector had. Private sector workers have been losing these benefits, particularly healthcare benefits, in droves in recent years. Since that time, with the eroding of the private sector benefits, we now are talking about state workers having the Cadillac plan of healthcare benefits. But one of the things that we're worried about as retired state workers, we want to keep the health care plan. And one of the reasons that we're so very interested in seeing universal health care is because we want to see other people have that plan.
There's over 400,000 people in Connecticut that don't have health insurance at all, and I understand over 40 million in the country. I think that's just unacceptable.
This country is in a dilemma on their health care. We've got a hodgepodge throughout the whole country. This plan here, this plan there, good, bad, or indifferent. We've got a good one. But people don't have health care insurance. And we're the only industrialized nation that does not have good health care for their people.
As state employees, my personal feeling has always been that to be a state employee, you had to care about people. And that's one of the reasons you become one is to help others that may be less disadvantaged, more disadvantaged than yourself. And I just just think universal health care is a great benefit to everyone. The state can pick up the cost for the people that are out of work or disadvantaged in some way. We can hopefully have a low-cost co-payment for people that are working. Have the state and the government business and people all work together.
Universal health care would solve with the emergency room costs, because people that don't have health care end up in the emergency room getting health care. They can't pay. Now, who's paying? When you come in with your Blue Cross, Anthem, or Medicare card and put it on the table, that's your paying for the person that doesn't have health care.
I mean, if we can get something where people go to doctors and under an established plan, it'll save everyone money and basically fund itself, and it's be better for all.
The politicians are not making decisions, they're taking polls. And they reflect the polls. You're not a leader if you're reflecting the polls, you're a follower. We need leadership. They know the problems, but they're afraid to make the decisions for some reason or other. So that's what we're trying to do, is give them, by pushing and writing them letters, giving them the backbone to stand up and make those decisions. So you get active politically in your hometown, write letters, call your representatives, don't be afraid of them. I can remember when I was president of the union, the elected officials saying to me, well, I'm Senator so-and-so, and I just said, well, you'll be in November. You're the power. They know it. And if you just remind them now and then, by letters, campaign, phone calls, they will respond. They may not always respond to the way you wish them to, but they'll listen to you, and you can tell them how you feel, what your position is on the issues, and try to convince them to be there with you.
Get involved by, talking to your legislators, both on the state level and the national level. We write to them, and we educate. We educate not only our own members, but we educate the general public out there, our family, friends, whoever we can get to, on the reasons that universal health care is needed.